Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today is Tuesday, March 30th, giving you the update from Albany Med. All right, first things first, Fred, happy Doctor's Day.
Happy Doctor's Day,
It's Doctor's
yes.
Day. We have over 1,000 physicians on our medical staff here.
We do.
Some are employed, some are from the community, voluntary staff. We're so proud of the work they do.
They really do a fantastic job, Dennis. They're so important to the health of our community, along with all the other providers here in our organization.
For sure, and we celebrate them today.
We do.
Let's pop open the graph. Capital Region, 8 counties. Fred, we are at 107 people currently in the hospital with COVID. We're going to dive into those numbers a little bit more. When you look at that graph, though, about a month really hanging in that same number.
Yep, we're kind of plateaued.
Right.
We really are.
Let's look at admissions and discharges to the medical center here, and you can see basically on each day, it's somewhere between 1 and 5 admissions, and basically about the same number of discharges coming
That's
out.
right.
Let's look at the AM census here at the medical center. 27 in the hospital, breakdown is 16 on the floor, 11 in the ICU, 5 on ventilators. Now, Fred, you led us through the regional call today.
That's right.
And there were some discussions on the regional call about various ways to look at that number. So let's take that 27. We know that at Albany Medical Center, 5 of them are no longer infectious.
That's right.
But there really is another category within that number.
There is, Dennis, and it's kind of a growing category, and that's incidental COVID.
Yes.
So someone comes in with appendicitis and we test them because we've been testing all of the patients getting admitted, and they turn out to be positive for COVID, but they don't have any symptoms. So we've been seeing, you know, a handful of those patients a week in that admission group with that incidental COVID. So I think it's an important number for us to start tracking. We talked a little bit about it after the regional call, and I think that will be the third category we start talking about.
So we might start saying we have 27 in the hospital, this number are no longer infectious, and this number here was an incidental finding.
Incidental. Now, it's important to know that they have COVID because they need to be on precautions. We don't want to expose people. They can still infect others, but that's not the reason they're in the hospital.
So one of the numbers that we follow very closely is what's the percent positive in the region. The capital region is about 2.4%, and that was a strategy that many put into place. You led us on sort of doing more testing when people came in the hospital for this very reason.
That's right.
Okay, very good. Anything else from the regional call today, Fred?
There was a discussion actually about the age group of people being admitted.
Right.
So as you know, Dennis, here at the medical center, we've seen a younger population being admitted. As a matter of fact, last week, the average age of the people we admitted with COVID was 47. And that's being seen in some of the other hospitals as well.
That's a really important thing to talk about. Let's dive into that a little bit. So what we're seeing is when we look at the people who are being admitted to the hospital now, not just at Albany Med.
That's right.
In the capital region, and in fact, we were looking at a study that was published out of Michigan, which found the same thing. The age of the people coming in the hospital is shifted a little bit on the younger side.
That's right.
So you're seeing more people admitted to the hospital who are, say, 30, 40, 50 than you would have seen a couple weeks ago. And people may say, well, why is that happening? I think many of us believe that this is evidence that the vaccine is actually working. The older population, which was the first to get vaccinated, is getting the virus less.
So Dennis, I want to say that nationally I've seen numbers where somewhere in the range of 2/3 of individuals over the age of 65 have gotten vaccinated.
That's right.
So they're getting to that herd immunity number.
So the virus, which is still out there, is still looking for opportunistic hosts, and so the population that is going to get infected now is going to be on the younger side.
That's right, and that's what we're seeing.
So why is this important? Because just yesterday we learned that in New York State, the eligibility criteria for getting vaccinated has dropped. Now 30 and above can get the vaccine, and in 1 week's time, 16 and above. So this is really a very important message to everybody out there that says, if you're in that age category, we're really going to be encouraging to get that vaccine.
You know, Dennis, the vaccine really works. There's more evidence in the literature. We were just talking about 2 New England Journal articles.
Yeah, share that.
Looking at healthcare workers at UCLA, University of California, San Diego Medical Center, and Southwestern Medical Center in Texas. Thousands of healthcare workers who've been vaccinated, and they've seen the same thing we've seen here. In the beginning, when they first got their shots, still a fair number got infected. By 2 weeks post their second shot, single digits in populations that are about 38,000, 40,000 healthcare workers. 7 out of 35,000.
Wow.
Yep.
So we can put those articles on the Schaefer Library
Yep, they were
site.
last week's New England Journal. Very important information.
So let's dive into this. So in the capital region, those same 8 counties we always talk about, 375,000 people have received at least 1 dose of the vaccine. So that's 34, almost 35% of the eligible population, defined as the adult population, 16 and above. And 213,000 have had 2 shots. As we know now, some people can complete the series with 1, some need 2. So that's close to 20%. So tremendous progress there.
That's really great.
If you take a step back and look at New York State, we're quickly approaching 6 million people who've been vaccinated. So Fred, I think we talked about this. The eligibility criteria is dropping. The capital region is going to get close to 61,000 doses of vaccine next week. We're going to encourage people, go to capitalregionvax.org, look for where you can get vaccinated, and let's use all those doses.
Absolutely. Get your vaccination.
Any word on AstraZeneca?
So AstraZeneca, we talked about this last week. The initial data that they put out in a press release, they backed down just a little bit. I think it was 76% versus 74% efficacy. So I think they're submitting their data to the FDA, and in a few weeks we'll hear what the FDA decides.
So Fred, the timing of this is interesting because tomorrow we're going to launch in the capital region a public service campaign related to the vaccine. And this is going to have many different community voices on it. Why don't we just take a second now and show you one of our 60-second spots.
We've been apart too long.
It's time to once again open our arms to family, friends, and neighbors.
Thankfully, a new day is dawning.
A new day is dawning.
Because together, we can end the pandemic.
We can end the pandemic.
The COVID-19 vaccine will be free
and available to everyone in the capital region.
With it, we can live without fear again.
Please, when it's your turn,
Don't hesitate. Vaccinate.
Vaccinate.
Don't hesitate. Vaccinate.
The vaccine is safe.
It's authorized by the FDA.
It can't cause the virus, but it can protect you and others from the virus.
And the more people who get the vaccine,
The safer we all are.
The safer we all are.
For when and where to get your free vaccine, visit capitalregionvax.org.
Really important message, Dennis. You know, get vaccinated. If not for yourself, get vaccinated for your family, your friends, and your community.
Excellent, excellent message, Fred. Last topic is, obviously we're going to be coming up on what for many schools will be spring break. Obviously members of the workforce, the community will be traveling. I think today our epidemiology team reminded us what the current rule set is related to travel and members of our workforce.
Right, so if you travel into the contiguous states, so Vermont, Massachusetts, Connecticut, New Hampshire, New Jersey, and Pennsylvania, you don't have to be tested. If you are within 90 days of your vaccination, your last shot, you also don't have to be tested.
Okay.
So if you're not vaccinated, if you're beyond 90 days, which I don't think any of our healthcare workers are yet, you need to be tested before you can come back to work, and then again at day 4.
So to clarify that, for the almost 95% of our workforce that is vaccinated, if they travel outside the contiguous states, when they come back in, they do not need to be tested.
That's
and they do
correct.
not need to quarantine.
That's
okay,
right.
very good. Because we do know that obviously certain members of our workforce may be traveling, and this is information which is changing. And that goes into effect tomorrow, April 1st, I believe.
That's right.
All right, very good. All right, so we'll be back again on Thursday. We already have a couple topics that we know we want to talk about. So we look forward to coming back again in 2 days. We ask that you once again, please take care of yourself, take care of each other, and get vaccinated. And we'll see you in 2 days.